You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says no more dentures, that nobody should be wearing a loose-fitting denture or a denture that's not attached to anything, like dental implants. With us, and he's been on the program before, always a great guest, Dr. Sutherland. Dr. Sutherland, welcome to the program.
Hey, thanks for having me back.
So for people that don't know your practice, because you have, I guess, a lot of practices, who's the typical patient and what are the different services you offer?
Yeah, what I basically offer is focusing on people that are losing their teeth.
Okay.
We have two main types of patients. The one patient is that loses one tooth. So they come in, they have a crown that they think fell out, they ask me to put it back in, and we realize we can't put it back in, there's nothing left. So we then give them their options about replacing it with an implant.
Okay.
And those range from people that are losing one tooth to 2 or 3 teeth. The other group of people are the people that are in trouble, and those are the ones that are losing everything. So those are the people we talk about replacing all of their teeth with either implants and snap-in, snap-out dentures, or we give permanent teeth. And then the third group of patients are the ones that have already lost their teeth and they've been suffering with dentures for the last 20 years.
Are there a lot of people with dentures?
Yeah.
Estimates?
You know, in fact, if you put together all of the stadiums in Southern California and you tried to fill them with all the people that have no teeth, you'd have people, you know, out onto the streets. I've heard numbers that there's 40 million patients that have no teeth.
Is that right?
Absolutely.
So there's definitely, you know, hundreds because this will be airing throughout the LA County, Orange County. So there's like well over 100,000 people with an upper lower denture.
Yes. And the biggest problem with people that have dentures is they're not attached. You know, they move over, they slide, they come out. It's not the most comfortable situation.
Well, if dental implants are so good, why aren't they all doing it? What's your take on it?
You know, Randy, my take on it is there's a few reasons. You know, the first reason is they don't come to the dentist. Every few years they show up.
So if you're wearing a denture, you don't go to the dentist?
No,
okay.
And when they do come in, they come in because they have a sore spot. They come in because they need their denture adjusted or it's getting loose. And they come in, it's quick, we get them in and out, and you know, I don't know if I want to say, I hate to say this, but most dentists, the last thing they want to do is deal with a denture. You know, the patients hate them, so it's not the most comfortable situation for the dentist. Mm-hmm. That's a big reason. You know, another reason is I think once a patient's gone through the process and lost all their teeth, it's something that they don't want to deal with anymore. It's almost like they're done. You know, those
like
patients.
The last thing they want to do is see you.
Yeah, I mean, those patients have, they got a bunch of cavities as a kid, got a bunch of fillings. Those fillings fell apart, and they fell apart and became crowns. So then as adults, they're putting crowns in their mouth. They're turning into root canals, and in each time, they're paying more money for each procedure. So now they're sick of it. They're sick of things failing and not lasting forever. You know, so eventually, when it comes to the point that they finally lose their last tooth, you know, for them, again, it's a relief. They're over, they're done. And that's a big reason. They don't want to come back, and they'll deal with, you know, not that the dentures, they're not happy with that denture, but it's a different set of problems they're dealing with now. I think a third reason would be money. You know, they see commercials, they hear about prices of implants, and there's a lot of teeth they lost. So if you start putting a dollar amount on that, it's a big number. And I don't think patients realize where we've come with implants, where we don't have to give, you know, 30 implants in the mouth. We place 4 or 6 implants and redo a whole upper teeth or all their lower teeth.
So full arch of teeth that don't come in and out. Yep. With like 4 or 6 implants.
Absolutely. In fact, we don't want to put more implants in that. If we put in too many implants, it becomes very complicated and there's much more problems going on. We get a better result nowadays using less implants in there. I guess another real big reason is fear. There's very few patients that I tell them they need an implant that they don't give me a fearful look.
Well, it seems painful.
And you know, the funny thing is, it's not. I tell patients, and I 100%, I'm the chief clinical instructor of the Painless Dental Alliance. And so I lecture to dentists on making dentistry painless. And it is way harder, in my lectures I talk about this all the time, it's way harder to numb a tooth than it is to numb the bone to put an implant in. There's nerves in teeth, and sometimes they're difficult. And patients have this experience in the past of they have a tooth that just couldn't numb. But implants aren't that way. It's a simpler process, and the numbing is 100 times easier than numbing a tooth in here.
Because the bone doesn't really have feeling.
There's no nerves in the bone. There's no nerves that we have to numb to do that.
So the implant that goes in the bone, there's really no feeling there.
Absolutely. So
Okay.
I think that, I guess the final reason to answer your question why they don't come in would be that they self-diagnose. They hear stories that they're too old. They hear stories that they don't have enough bone. In fact, they go to dentists a lot and are told by dentists that they don't have enough bone. And that's probably true. They probably didn't have enough bone based on the experience of that doctor. To place an implant, there has to be a certain height of bone and a certain width. But nowadays, we've figured out ways to get around this problem. We can put in fewer implants, we can place them in different locations, and if we have to, the worst case scenario, which is a rare experience that they come in and don't have bone anywhere, we can build the bone. We know how to grow back bone nowadays, so there is not.
So there's no more excuses.
No, there's not a patient that walks in.
At the top of the show, when I said, and this was based on talking to you, no more dentures.
Yeah.
I mean, the way traditional dentures.
Yep.
That means you don't believe anybody should be wearing a traditional denture.
No. There's no reason for a patient to wear a denture that's not attached in there. The only things that get in the way are money, insurance problems in here, and getting the word out to patients and getting dentists trained to be able to deliver it, to be able to deliver the treatments that's needed to attach a denture to the bone.
Okay, now insurance does not, just covers a very small portion. Like Medicare, Medicaid does not cover dental implants. Even in Canada, I know they don't cover dental implants.
Right.
But you have financing available.
Absolutely.
Things like that.
Absolutely. In here. The dental implants, most people that come into my office, they have a cell phone, they have a car of some sort, and those were not cheap things to do. In fact, most of the time we make little payments on our new iPhone we buy, or we make payments on our car no matter what the costs are. And when you're getting into big implant cases and replacing all the teeth, it's a similar scenario. We can fit a payment plan into most people's budgets to be able to do that. We definitely want to get all we can out of insurance, and we'll do that. And then nowadays we can use medical insurance in some cases, and we can use dental. But there are definitely limitations on what they'll cover, and we work it into a payment plan that fits into someone's budget.
So how old can you be to get dental implants?
There's no age. I mean, everyone is a candidate to have implants, and everyone deserves to be able to have teeth to chew and to smile with. And I'll give you a great story. I was at a convention last weekend, and it was talking about the technology that we have to be able to place implants nowadays a lot easier. And one of our speakers was Tony Robbins. At a dental conference. At a dental conference. And the first thing he did is came out and he wanted to thank, in fact, he has a company that works with dentists, mainly because of the impact that dentistry had on his life. He's kind of known for these big teeth, and he had some treatment done to help with that. And he gave this story. He's doing a research project right now on extraordinary things people do late in their lives. So he's out going around the world researching people, and he told us a story about a nun who in her 80s was told that she looked like she was having a baby. So she decided to get in shape. And she started running 5Ks and 10Ks, and it turned into marathons. And I believe at 95 years old, she's running Ironman races.
Okay.
And she had this, great story about going to Hawaii, and they told her she was too old to race, so she decided it was free land, it was free ocean, it was free, bikes and things. She doesn't need that number on her shirt. She threw that number on the ground and said, I'm gonna run along the race. I mean, and if people are doing that in their later years in life that nowadays, and can you imagine doing that with no teeth? She's not swimming in that ocean with dentures around in there, or at least not doing it comfortably, or riding through on the wind. So there is no reason at any age limitation.
So how old can you be? I mean, how old, what's your oldest patient?
We have patients in our 90s.
Is that right?
Absolutely.
Why would a 90-year-old want to go through this process or get dental implants?
For the same reason that you do.
Okay.
When I decided to come on this show, or you asked me back, I decided to look up and see some things on Facebook, and I see things that you guys enjoy that run the show. You post meals that you go to these great dinners after you have a bad day at work to make the day better.
That's right.
I see things on there when we're going to celebrate. I see pictures of people having a piece of pizza and having a bite with their kid, and there is no reason. Well, I'll tell you what, I don't think there's a high enough dollar amount I could give you to trade places with these people at this amount.
Have no teeth. That's a good point.
Absolutely. Absolutely.
So at any age, they want to eat and chew.
Absolutely. Everyone wants to do.
But I know a few denture
we do.
wearers. I don't, with all due respect, I know denture wearers, and they never complain to me.
Yeah.
They seem fine with their denture.
People learn to, be happy with the situation they're in. Or I don't want to say maybe happy, but they get by, they survive, they learn to live that way. But let me tell you about. I get to see the complaints every day of the denture wearers, okay?
All right.
So I hear the stories about how, I'm on this diet, and ever since I had these dentures, they kind of laugh, and they actually tell me, well, you put me on a diet now that I can't eat anything. I hear the stories about they want to go on a job interview next week, but they're really concerned because it falls down when they smile. I hear the stories that they're going to go on a trip. They decided to go on a cruise, so they're really worried. Their denture's loose now, and it's fallen out. These are not... when they have to live with these problems every day of their life, and they just learn to deal with it.
Now, one of the things you said to me, on the telephone, is that people could walk into your office on the day of the procedure without teeth, literally no teeth, and walk out with a fixed set, a full arch of teeth on the upper and lower that don't come in and out.
Yeah,
that happens.
It happens. So, and it didn't used to happen. We've come a long ways as far as how we replace these teeth. We used to, or the typical way it's done, and it's done often still to this day, we send you to a surgeon. Surgeon will place the implants. You'll wait for them to heal, and then you'll go back to a general dentist or a prosthodontist who will start making the teeth. And so the process, it takes a lot longer time. Nowadays, what we can do is we can actually scan the mouth, see what your teeth and your gums look like. We can scan the bone to see what the jawbone. We can plan these implants in the bone. We can plan what we want the teeth to look like at the end on a computer. We merge the two technologies together so that one thing is we place them exactly in the same spot so that the implants match the teeth. And then the other thing is we can actually make the teeth before we place the implants, because we place these implants through guides, through the planning software, and so we know exactly where we're going to place this before the patient comes in the office. We can have the final tooth made before they step in. The implant's placed, the tooth's put on top.
So like 2 visits. The initial visit,
Yeah.
they could, if everything works out right, the second visit, they have their teeth.
So 1 to 2 visit depending on the bone, depending on how stable those implants go in. Some people come in, it's great, we put the tooth in the same day. Ones that need a little bit of healing time for strength, we do 1 visit for the implant, we have the crown come in, we put it in.
You believe that you're transforming people's lives. We had you on the program before, talking about smile makeovers, cosmetic dentistry, but when you take people without teeth and give them teeth, you say it's even bigger. Elaborate on that.
Yeah, the normal bread and butter dentistry we do, patients, they come in, they get the work done, but they're not jumping around for joy as coming into this appointment. But the patients that we are replacing teeth, when I have patients, one patient comes to mind in here that she had been dealing with losing her teeth slowly over time. And when she finally got in to take out the rest of her teeth and give her permanent teeth in here, she was one that actually went home the next day. I think it was Thanksgiving was the situation, and she decided to see an apple in the backyard of her house, and so she took a bite of that apple. Well, when she came to my appointment the next week, we had told her, hey, kind of be careful, take things slow in here, and so she goes, Dr. Sutherland, I got to tell you, I got to confess, I actually went in the backyard and took a bite of an apple. Is it going to ruin everything in there? Oh, no. Just to see her face to being able to do that was, those are the stories that we see all the time on the people that are getting back their teeth. Yeah, I had another patient, and in fact, this is someone I know, and so we ended up, she had bad teeth, they were failing, so we ended up taking out these teeth and giving her the implants and then placing a temporary on that day. And I had to do a function outside of dentistry where I was going to run into this person about 3 days after the surgery. And I was a little bit nervous about running into this patient of mine, and I was afraid she was going to be sore, and again, no one likes to see the dentist that often here. So,
okay.
And she actually came in, had makeup, was smiling. In fact, told me a story about her husband noticing her, you know, and this was with the temporary in here. I had never seen this person wear makeup in my life in there. And to me, again, that tells the power of getting the smile that you're comfortable with. All of a sudden, all these other things about your body and your face all of a sudden become important to you again, where they didn't on all those years she was suffering with teeth that she was embarrassed to show.
So you could eat whatever you want? I mean, with, like, for example, if somebody gets a full set of teeth, they had no teeth, now you give them a fixed set of teeth, they could bite like
anything they want.
they
They can go out and
popcorn,
have
things like
steaks.
that? They're not limited?
No, there's no limitations. They're permanent teeth. They're as strong as your natural teeth. You can eat steaks, you can eat nuts, they can eat anything they want. They can tear things.
But isn't it true, if you've been in dentures for like 30 years,
Yeah.
you can't, that you don't have enough bone for...
No, it is true. I mean, patients lose bone. And that's what most patients don't realize, is that when they lose their teeth, it's kind of like when you put your arm in a cast. You take your arm out, the bone's small. When you lose your teeth, there's nothing promoting new bone growth. So they come in and there's not a lot left under those dentures. That's why they don't fit. That's why they move around. But we don't have to put implants. We have the ability nowadays to put implants where there is enough bone. We have the ability to put implants at different angles and different locations. So we can use the bone they have. Everyone has some bone, and we can use that bone to strategically place the implants to fit the permanent teeth. And even again, on worst case scenario that they don't have enough bone, we have oral surgeons that can rebuild bone. It takes a little bit longer.
Now, in your group, you have an oral surgeon.
Yeah, we have oral surgeons right there. And any of the patients that need any bit of bone building, they build the bone up. It's a fairly easy procedure to be done. We just have to wait a little bit longer for it to heal before then we can put the permanent teeth in their mouth.
So if somebody's watching this, because you talk in terms of getting it done very quickly, is that right? If somebody's watching this and they are wearing a denture, if everything works out right, how soon could they be in a fixed set of teeth, upper and lower?
2 visits, and the first visit is to come in for a consultation and take a scan of the bone. Second visit is to place the implants and the permanent teeth. We just need enough time in between to make them, which is usually about a week, okay, to make
So
the
next
teeth.
week they could be wearing a fixed set of teeth on the upper and lower?
Yep.
Is that right?
Absolutely.
So it's just, I mean, is your take that, and we talked about this earlier, but the denture wearers, if they knew this option, they would all do it?
Yeah, I mean, I haven't seen too many patients, even though I do have a lot of patients that say I'm fine with my dentures, but I have very few patients deep down that say they love their dentures and wouldn't want to get rid of them if they had the choice.
So what about those patients, though, that they're headed toward dentures, right?
Right.
They've been told maybe their teeth have to go, but they have like gum disease, right? They have bad gums.
Right.
Are they candidates for this?
No, those are the perfect candidates there, because the only way we get rid of gum disease in bad situations is to pull the teeth. And when we get rid of the teeth, the gum problems go away. It's kind of like a splinter in your hand. You get rid of the splinter, the hand heals.
So these people with their mouths are an absolute mess. Maybe they haven't been to the dentist in 15 years. You're
heal
saying
up.
they're ideal candidates.
They will heal up absolutely fine once they get rid of those bad teeth. And then they're in the same situation as someone that had lost their teeth already.
But the people that they've been told somewhere else, your teeth have to go. How soon can that happen? Like, what's that like? Like from extraction to getting your teeth?
Yeah, it's actually a very similar process. Again, we need a consultation, we need to scan their teeth and the bone, and once we come up with that guide to place the implants, we actually can, in most cases, extract the teeth and place the implants the same day. And when we can do that, we can put the teeth on the same day. There's no waiting period. Sometimes we have to come back and do a little more work down a few months, but most of them is the same scenario as the patients that are already missing all their teeth. Yeah, so I had a patient, just like you're talking about. She has gums problems, gums are bleeding, teeth are falling out, and she's been dealing with it for years and years. In fact, she hasn't worked in 5 years. Her son is the one that brought her into my practice. She's decided she needs to get her life back together. She started by going to her doctor and got that part of her life under control. And when we sat down with her, and first of all showed her that she does have enough bone to do things, she was worried about that. First of all, that gave her hope. And so with this patient, she had 2 options. We're either gonna do snap-in, snap-out dentures, or we're gonna do permanent teeth, and she absolutely 100% wanted permanent teeth. And so that's the way we went with the treatment. And she's one of those that when she wanted to be put to sleep, so we put her to sleep.
So you have what, sedation?
We have
IV
sedation. Yep.
Okay.
So we put her to sleep. We have an anesthesiologist that does that, and we place all the implants, and she wakes up, and obviously in those cases they wake up and the teeth are in their mouth. And again, those are the ones that make it fun and make it meaningful for me to practice. Those are the patients that come up and they got a tear running down their face, and they turn around and usually they hug the assistant next to me first. In fact, my assistant Hannah, they all want to hug her first. And so again, and then her son came in, and that was a pretty emotional time to see the son come in and do it. And again, those are the cases that there are more people out there that could benefit from this. Yeah, and you know, Randy, you should have saw her face, you know, and she's, I mean, in one afternoon, we went from no teeth or bad teeth in her case to nice teeth that she can eat and chew and smile on when she goes home that afternoon. She's gonna be able to go out and get a job with confidence, smile with her family, you know, go out and eat the foods and obviously in her case, she was looking forward to getting back in the dating world. She had been out of that scene for a long time, and she wanted to get back into that, and now she can. This will be
So when you're dating, I guess, and you have a denture, probably makes you self-conscious.
I mean, I don't think we'd find someone out there that thinks there's anything sexy about a denture. Okay.
So no more dentures. Are you going to wipe them out then? I guess in where you are in California, you're going to wipe out.
Well, I won't be wiping them out, but we need a big team of dentists here to help out and deal with this problem.
We are out of time, but when a patient goes in and they're wearing a denture, right, and they want to know their options, what are their options?
I mean,
what's that discussion like?
Yeah, there's two basic options we give them. One is to place a few implants, and we make a denture that snaps in and snaps out. So we don't have to use glue. It's got good stability. They can eat a lot more foods than they can eat with their regular denture. And that's a good option for a lot of people. You know, now obviously if we put in a few more implants and we make permanent teeth, that's a big step up. You know, and in those cases, we're able to cut away the denture. So there's nothing covering their palate. They can taste food, they can feel food. They don't have to still have the psychological factor of being able to take something in and out of their mouth. You know, once they get those permanent teeth, they can't remove them. So those are the two options and that we can give them.
So is this the future of dentistry? I mean, in the future, whether it's 20 years or 100 years, nobody will be wearing like a traditional denture?
Yeah, well, it's not
the
future is now. It's happening now. It happens every day at certain places around the United States.
So get them attached to dental implants.
Yeah, there is no reason that, again, for 99.9% of the people that are missing teeth, they cannot attach their dentures or attach permanent teeth to implants.
Now, your center, I guess how it's normally done, you go to one doctor that does a surgery, another person that does puts a tooth on top, and then an imaging center. You do it all right there.
Yeah.
Aside from convenience, is it better for the patient?
Yeah,
to do it that way,
absolutely.
Where it's all right there?
Most of the studies now show that the less involvement in the mouth, okay, the less we're in and out and doing different things, the better result. The less failure we have in these products. So to do everything in one visit is better for us and the longevity of the dentures and the teeth we're making for them, okay? And it's better on the patient. I mean, who wants to drive around and go to 10 different appointments?
Yeah.
My biggest reason for doing that was the frustration. I think early in my career, referring patients around to different offices, there's always a little bit of lack of communication. And so when you have them in that same location in there, you know, we can bring each other in the room during the middle of a procedure and go, hey, I got to do this here. What do you think? Okay. And we come up with a plan together. So 100 out of 100 times, we get a better result being able to do everything.
So you like it right there, one location, and no more dentures. And you say it doesn't hurt that much.
Yeah,
right? I mean, during the procedure, it doesn't hurt at all.
Anyone that's made it through a filling in their life can make it through implants.
Because there's going to be some pain, right? Obviously.
Well, we have to numb.
Discomfort, we have to say.
There's going to be some soreness afterwards, I always tell them.
But what's it like? Like, what do you give them to go home with or the next day? What's that downtime?
I mean, half my patients, I would say, take a couple Advil at home and are fine. My other half of patients want something stronger. So it just depends on the person. Everyone feels things a little bit different.
And sedation is done right there. Is it true that people sometimes don't even remember the procedure?
Yeah. Now,
Like there's a bit of an amnesia? Or
absolutely. Now, when they get sedated, they do have an amnesia effect in there, and so they don't remember the procedure or what was going on during it, which is one of the benefits of being put to sleep. It's one of the benefits of the anesthesia.
Now, do you ever have patients that say, doctor, you've probably never seen teeth this bad in your life? Or this is the worst thing I bet you've ever seen?
I not only have patients that do that, I have to tell this every day to patients. Every day I have someone telling me, oh, I'm embarrassed. These are the worst teeth you ever see. And I have to tell them, this is what, you're normal. You're what walks in here every day, what I see. I got almost 20% of the United States dying with no teeth in here. So it is a normal process to lose teeth. That one of the reasons that they walk in and think they have the worst teeth in the world is they just don't smile. They find miraculous ways to hide their teeth.
So people with bad teeth, you never see their bad teeth.
And amazing thing, I'd say half of them walk in with hats. They walk in with different, again, ways that they've learned to disguise their teeth. And the most dramatic thing we see always, and this is another benefit when we give them the teeth, is we take measurements of their smile and we see how much teeth shows. And I'm telling you, every time, from the measurements we take in the beginning with their bad teeth to the change when they got the teeth, it's almost like their muscles changed in the meantime, and they didn't. All of a sudden now, their smile comes out.
Now, you're a cosmetic guy, because we had you on the program talking about cosmetic dentistry, veneers and things like that. Do these dentures that you make, these snap in, snap out, or fix, do they look real?
Yeah, absolutely.
They do?
And I always tell patients, as far as cosmetics, it's a no-brainer. We always can get the cosmetics right. Okay, it's just a matter of time and effort to find out what the patient likes. We don't want them to look too white or too dark, and a lot of it's personal preference in here. And that's why I strongly believe in being able to make changes at the office. If you don't have the lab or don't have the ability to put custom changes, and we use custom stains and all these things to be able to, again, the traditional way to do this is to send the teeth across town, and they make the teeth over there.
So you do it right there?
Yeah, and you have to, because there's always little subtlety changes that we have to make. Again, everyone's a little different.
So you really do everything right there?
We try to. We try to do everything right here. Yep.
Okay, good. So no more, we're out of time, by the way. So no more dentures. If somebody wants to make an appointment with you, they can contact, I know you have a bunch of different offices.
Yep.
What about consultation fees, things like that?
Yeah, we don't charge for consultations,
Okay.
nope.
That's very common, by the way, especially in the LA market.
Yeah, anyone can come in and anytime they want.
So good evaluate. Final message, a patient watching this, maybe they're wearing a denture and they're skeptical. They're going, I don't know, maybe I'm too old. Or the other person that you mentioned, their teeth are falling out. Yeah. They think they're not candidates. What do you say to them?
I just come in. Come in, it's real easy to take some pictures of your teeth, take some pictures, and see what we can do. That's it. There's no reason not to find out what your options are.
So no more traditional dentures. Good for you. All right, I want to thank you for coming on the show.
Thanks for having me.
Always a pleasure. You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.